在美国，肝移植以后的另外一个很大的问题是丙肝病毒。在以前，只要手术后患者身上存有丙肝病毒的话，会导致病患死亡。但目前有了一种新药，可以改善这种状态。
Hepatitis C, which is a bigger problem in the U.S., has now been cured by the first drug. You may have heard this drug. People say $1,000 a day in the U.S. And so we've studied multiple combinations of this drug with other agents, and we now know we can cure hepatitis C. And this used to be the big killer for patients after transplantation. The hepatitis C virus would come back, and the patients would die because there was no good treatment. Now, many of those people that died on me years ago could be saved, could have been saved with this new medication. Expensive, but works.
经过移植手术活下来的人，确实意味着肝癌已经治愈了。一些患者有的可以活到80岁。
We've transplanted some of the longest survivors and certainly the oldest people. And we've transplanted the 76-year-olds for liver transplantation. The gentleman we were taking to the operating room today was 74. And so they can well certainly live into their 80s. And then the things that get them are old age. But as long as the virus doesn't have a problem getting back to them, the cancer has been cured.
美国没有足够的人捐献器官，虽然美国一年需要肝脏移植的人很多，只有一部分人能够得到器官，其中活体捐献是一个非常小的比例。在美国，多数是由死者捐赠，这样等待器官的时间就比较长。
It's not uncommon that if a patient is waiting for a deceased organ and they have a cancer, they could wait 18 months. So there aren't enough people donating organs in the U.S. This is a problem that's seen in China, a problem seen in Korea and Japan, donation. So we have a system, but there aren't enough people in the system to make it work. So although there may be 17 or 20,000 people in the U.S. who need a liver transplant a year, only 7,000 get them. And a very small percentage of getting them about living donation, so the majority is by deceased donation, and that's people signing their driver's licenses, telling their family about organ donation, but most people don't talk about the topic, and then when it happens, those bodies are buried.
因为等待器官的时间比较长，有些患者选择出国做器官移植手术。美国的肝脏移植专家 Thomas Sciano 从道德、伦理以及风险的角度谈到了他的看法。
Well, some of them go to other parts of the U.S. where you can get transplanted sooner. Some people choose to go abroad, and very often they do choose to go to China. Now, this used to be a much more common occurrence in years gone by. There was a lot of consternation amongst the transplant community, and the physicians were banned at presenting at our conference, at the transplant conferences, for instance. Ultimately, this practice, I believe, has decreased, but is still going on. So obviously we have a lot of ethical issues with this, because organs are obtained from patients, we feel, without their informed consent or without the informed consent of their family. And ultimately this works against the true altruism of organ donation. Well, this is one of the problems with what we call transplant tourism, is that very often patients, after they undergo the transplant procedure, are given a finite period of time for their medications, and they're not given a lot of records, and they return to the United States. This is often money out of their life savings, because insurance carriers are not going to pay for the transplant. So they come back and they're really desperate, and some liver transplant centers actually do not want to take on the burden of caring for these patients. So currently, we do not recommend people to go outside of the continental United States for a transplant. Outside of the U.S., there are no regulatory bodies. There are no statistics published in terms of how people do. So in good conscience, we can't recommend that people go abroad for their transplant. People go abroad all of the time to have heart surgery and orthopedic surgery, where it's a lot less expensive in the United States. I think that it's a little bit different than going abroad and having a liver transplant. So we don't recommend that people do it, and we just caution them that if they choose to do it, what are the potential complications, what are potential risks, and to contact us as soon as possible if we can help in any way.
纽约